It's your eye health experts, Prevent Blindness Texas, and welcome to Eyespiring, a conversation about all things vision and life.
Hi, and welcome to Eyespiring. I'm Heather Patrick, CEO of Prevent Blindness Texas, and your host. Today, we have a special guest, one of my longtime friends and colleagues, Dr. Radhika Rajgopal Singh. And we're going to ask her all things health related and just have a really great conversation about prevention, community health, leadership, and the tie maybe between heart and vision. And we'll get to that. Radhika joined American Heart Association in 2017 as a senior vice president, Science and Medicine. She oversees the science strategy for professional membership, content generation for scientific publications, and clinical practice guidelines and diversification of science product portfolio. She has over 2 decades of strategic planning, operations, and performance management with diverse academic, public, and nonprofit organizations. Really, she's just a total badass. And I know this because I have worked with her and watched her career grow and consider myself very lucky to have learned from her while I was at Komen. Radhika, tell us a little more about your background, and then we're going to dive into some good questions.
First of all, thank you so much. I am honored to be a guest on your podcast, Heather. When you reached out, it's always fun to get in touch with you and hear and see what you're doing and all the amazing things that you accomplish. But more so when you asked me to be a guest on this conversation with you, I was like, yes, for sure. And I have learned so much from you as well, Heather. So it would be wonderful for us to match our notes and talk a little bit more about that. So thank you.
You're welcome. So you started your career where? How did you launch your career?
Great question. I wish I had all the answers, ironed out. So I came to the US for my studying, for my doctoral program. I started at Virginia Tech and I got a PhD in international health. And once upon a time, my plan was join the UN and make, your life as part of the greater good. Well, then I married the boy next door and life changed. And so invested in a postdoc and then started with the Indiana University School of Education, which gave me some excellent grounding in evaluation and how to use evaluation as part of program planning. And I think that fundamental training has really helped across all of the different roles that I've had in my life. Moved from there to the Indiana School of Medicine. And then my daughter was a NICU baby. We almost lost her. And so I took a break, moved to Dallas with my husband's job. And so my short break was a good time of reinforcing I need to get back into the workforce, but I also wanted to do it in ways that could also contribute to the community. And so I started with Komen as a volunteer. And, I was critiquing all of the grant applications, and the person that you worked with basically said, oh, well, if you're critiquing this, go ahead and make the changes and take up a job out here. And so started working with Susan G. Komen as the Director of Community Health and got to work with you as well. And then from there moved on to the Southern Methodist University and had a wonderful career opportunity out there. President Bush had finished with his presidency and had inked a deal with Southern Methodist University to build his research institute and library. And as part of the endowment with SMU, there were certain positions that were going to be built. Mine was one of them. And the goal was really to create a Center for Global Health Impact. SMU had no school for public health, no medical school as well. And so this center was going to be pulling together the various faculty across, chemistry, biology, engineering, business, mechanical engineering to really fulfill what global impact could look like. And then from there, almost a decade now with the American Heart Association, progressively growing, always with the science area, but progressively growing and loving this role with the association.
So. Yeah, it has been pretty amazing to watch your career. And I love the opportunity you had at SMU. I mean, what a cool way to take everything that you had done to that point and really be able to put it into play.
Yeah.
Yeah.
Especially because Komen was such a big part of the pink ribbon, red ribbon,
Yeah.
PEPFAR program, that President Bush's legacy program and investment that continues. And it was such a wonderful opportunity to take all of the learning from Komen and continue to build off that in the ways that we really did envision the global scaling of the community program and the opportunities to kind of bridge the gaps in cervical care, cervical cancer, and breast cancer as well. So it was really a great opportunity and learning.
Yeah. So talk about what science strategy means at your current organization. What does American Heart mean when they talk about science strategy?
Absolutely. So the American Heart Association turned 100 in 2024. And then with the century of extraordinary accomplishments behind us, we kind of turned our focus into what we call the second century vision. And our second century vision statement is advancing health and hope for everyone, everywhere. Our mission is to be a relentless force for a world of longer, healthier lives. And I cannot tell you how much more we've doubled down on what that means in terms of providing access, to good quality care. So in the association, what the science, the core of the science, Nancy Brown, our CEO, would always say, science is the foundation of the association. And the science strategy extends across the realm of funding meritorious research, allowing for the best discoveries and data that then inform the clinical practice guidelines, the work that is done with the hospital systems and with the patients on implementing guideline mediated therapies and care, and then allowing for advocacy. So science translations into advocacy, science translation into consumer and patient education, science translation into clinician content and professional development, some of the best meetings, scientific conferences, scientific sessions, and our international stroke meeting are our two flagship meetings. And we have 4 amazing, smaller footprint, but really good content meetings in between. So our science strategy really is focusing on that emerging science and bringing it to fruition, bringing the best volunteers and collaborators across the world. And then our publishing, we have 14 really strong journals. We're the second largest funder outside of the government. And I would probably say in this next 2 years, we might even end up being the largest funder of cardiovascular and cerebrovascular research. And so all hallmarks of what the association calls its science strategy.
So you clearly love your job, just listening to you as you talk and your passion. What's your favorite part of what you do?
Learning. I think, I have been a consummate learner all my life, and I continue to do that. I didn't have a cardiology background. I didn't have an oncology background, really. But learning so that I could implement it, understanding is a big part of my everyday job. I have to learn about clinical practice guidelines. I have to learn about clinical areas. And I always tell my team of science and medicine advisors, each of them way more accomplished than I am with either an MD degree or a nursing background, that they went to med school and I didn't. But I learned so that I can present. I learned so that I can train the next group and so on. So that's a big part of it. The other one is the people. The association has some of the best people to work with. And I've had that blessing pretty much in every role. I had amazing relationships, both within our staff team in Komen, as well as our external collaborators. And I've had that continue. And so I think those are my 2 most favorite parts of the job.
So what motivates you every day to get it? Because this is not, this industry is not easy, right? It is always changing, right? You got to be flexible, adaptable. There is a pretty constant stress, even when you're a huge organization, right? And the end with the changing external environment, I just think it is sometimes very challenging to be in this sector. So what keeps you going every day?
The association has a question or line that we always say, what is your why?
Mhm.
And I will tell you that, Heather, you know my story. I came to the US about 6 weeks after my dad passed of a sudden heart attack. He was 56. And 6 weeks later, I was here, partly because I was stubborn and wanted to continue, with the dream that he had and I had on getting my doctoral degree. But I think now when I know so much more about CPR and the systems that need to be in place to allow for someone who might have a heart attack to be saved, I just cannot keep thinking about, had my mom known, I was not in the same city, had my mom known, and you cannot go back and change your life or what, dramatically shifted in our lives. But one of the things about the Heart Association is its investment in those initiatives and mission driven priorities where really, we look at where can we save lives, and everybody has the opportunity for a longer, healthier life. And so CPR is one big area that the association has invested in. Our work with BLS, ALS, the clinical practice guidelines, that's my motivation. The fact that every single time we publish, we bring a group of volunteer experts together on consensus and look at emerging science in areas that have the most discernment and challenges and talk about what else we can do. It makes it easier, better for another family, another patient, and the world at large. And so I think that part, and the fact that the association is so savvy in how it fundraises, how it invests what it fundraises in. And across the board, we have a great brand. Our brand has been nominated multiple times as trustworthy. The team that supports and protects the brand, like I say, our CEO always says science is the foundation, but across the association, advocacy, our media communications, they all lean in to make sure that the world at large understands why the association does what it does. And our volunteers. I mean, we stand on the shoulders of those giants, and I get to work with them. They were names on textbooks for me, and for a nerd like me, that was huge to know that, I actually was sitting across the table and talking with them and helping facilitate a scientific manuscript with them or broker conversations for a mentee of theirs and so on. I mean, the kind of high that you get from that, I haven't been high on anything before, but I can tell you safely that this kind of a high is just unique. So those are all my reasons, Heather.
Yeah, that's pretty amazing. So you have really had the opportunity to look globally. You've been on multiple different teams and work, even though you've been on the science or community health side in almost every way with each position. What is one of the biggest lessons you've learned that you wish you would have known earlier in your career?
I think managing the anxiety, I don't know if it is age, when you are plus, there's a certain kind of a sense of either knowing that eventually everything will work out one way or the other. It might not happen in the ways that you envisioned right away, but it does work out. And if it doesn't, there's always a plan B. I tell my younger mentees or my kids that, if God intended for us to have only one path, it would be just A. The alphabet would just be A, but we have A through Z. And so there's at least 26 options. And, sometimes they'll roll their eyes at me. But I think I didn't believe that as much then. I knew somewhere that things would work out, but I don't think I exuded that confidence.
Yeah.
Now, even when the big things happen, there is relatively I wouldn't say confidence, but almost like a trust that it will work out.
Yeah.
Things will one way or the other work out. And I think if I had known that I would learn this lesson sometime along the journey, I could have potentially saved myself a lot more anxiety.
Yeah. Yeah. That's a great perspective. That is, you are like our 22nd or third interview this year. And we ask that question pretty often. And I think you are the only one that has really given that perspective. And it is so on point because you are so right. When you're overachiever, perfectionist, right? You do early in your career. I do agree with you that anxiety to, I think, be the best you can be and wanting to kind of control the path, right? And the older you get, you really do have that confidence of, I'm going to go where I'm supposed to go, one way or the other, right? And I love that. That is such a great point.
And you're more comfortable with the unknown.
Yep.
You're more comfortable letting things be slightly unresolved.
Yeah.
Um, you are okay with knowing that you gave it your best shot. It might not have been, solved to the nth degree, but that's where it's going to be. And I think you're just more comfortable with that. It doesn't mean you've dropped the ball. It doesn't mean, and that's the
Yeah.
difference. I think that people think that when you say that, does it mean you're okay with not seeing something through? It's not. It's just that you're okay with the how. I think
Yeah.
focusing on the how of the journey
Yeah.
versus, the time to get to where you want to go or where you want to go. I think the how of the journey somehow becomes more important. So.
Yeah. I totally agree. I love that. So on that, throughout your career, um, was there a person that really kind of changed your path or influenced you that had the most impact on you?
Multiple people. I think the ones that I would certainly name would be my dad to begin with. My dad was a constant workaholic, and but he loved what he did and he loved life. He was a smoker, and there was this tagline on the cigarette pack that he would buy that said "Live life king size." But
Hmm.
my dad actually lived life king size.
Yeah.
And so I took from him, I think, that passion for, if you do something that you really love, it's there for the world to see. So I think that was a big learning for me to really, don't do the things that, and I tell my kids this, I don't, be who you want to be, like pursue the career you want to pursue if that's what you want to do, but do it because you love it and you have a purpose. That's one. Eric Bing was another very
Yeah.
prominent mentor to me. He was my supervisor and boss at the Southern Methodist University. He is a trained psychiatrist and business strategist and a public health potential, and probably one of the most humble people that you would ever get to meet. What Eric did was, he spent a fair bit of time on professional development going through Clifton Strength Finders for me. Nothing that he said was unknown to me, Heather, but it is the how he said it and uncovered and polished certain facets of who I am professionally and personally, and what that brings to the workplace and how I could engage. That was a life changing moment for me. I still go back to the notes, I still go back to the recording to remind myself on what I may have missed. Another one is Mariel Jessup, our Chief Science and Medical Officer at the Heart Association. I call Mariel my blue sky. Because I don't come from a cardiology background, when I propose certain ideas, I always worry that what if it comes across as a stupid one? And people are going to think, she leads this area of science and she doesn't know. Mariel is my blue sky where I can be and say anything, and she would take it in, with the understanding that I'm looking for feedback constructively and kind of talk through, yes, this is a great opportunity, or consider this as well, which is her way of also saying, maybe not this way. So I think the mentors I talk about, my immediate boss, Nicole, is also very lovely in many ways of how she is very thoughtful in how she'll come back with, her 30 years with the association and how she bridges for someone like me that doesn't have that tenure. I learned from people like you. You and I were at different parts of the association, but if you remember how frequently I would come up to your floor and talk to you about, challenges with talking. I think when I think about the mentors that have helped shape my career, I think about those whose words of wisdom or even a happening, a
Yeah.
conversation would have changed or altered how I did what I did or how I would show up. Uh,
Yeah.
and that's what I carry in my heart and the deep friendships from that. So.
Yeah. 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 Home was sometimes a hard place just because of the pace and something always happening. But the people that were there, I mean, some of those people were
Extraordinary.
just incredible. I mean, so many relationships. I mean, I traced back so many pieces of my career to that position and working for them, and being there for a decade. And it's certainly, there are just some organizations that are like that bring these amazing people that you probably would have never crossed paths with, right? And they bring them into your life, and you just learn from them and build these amazing relationships. And years later, still in touch and still learning. And that's what great organizations do, because they bring together
Yeah.
amazing people.
And they push you to
Yeah.
your potential that you didn't think you could
Yeah.
have. I mean,
Yeah.
Komen certainly was defining for me in that it brought me out of my comfort zone of this is how I operate. And it tested me in terms of, I remember when we would talk about the affiliates and they would say, well, when you've seen one affiliate, you've seen one affiliate. And in my mind, where everything has to be this logic model, I was thinking, well, what does that even mean? Till I actually got to speak with them and realized, oh no, if you want to engage with them, you're going to have to speak their speak.
Yeah.
That was one of my first lessons with Komen on learning the individual speak and then bringing them to the table and harnessing, into the format that you might want, but not directing it as, well, you're going to do it this way. So, Komen taught us a lot and allowed us to flex, to flex traits or talents that may have been latent or new, and learning from some really amazing people as well. So I think definitely a hallmark moment.
Yeah, I would agree. All right, so let's talk a little bit about American Heart. In the sense, how do you decide what research or clinical guidelines get prioritized?
So the clinical practice guidelines and research priorities are actually driven by what's happening in the landscape, where some of the biggest opportunities and movements are. Clinical practice guidelines are very protocol driven. So we have, for the cardiovascular guidelines that we do with the American College of Cardiology, our partner, and then we have several collaborators on guidelines depending on the topic. We have a joint committee that reviews the landscape, that looks at some of the clinical trials that are coming out that would be practice changing. We look at things like how big would the effect be? How strong is that trial? Is it truly going to be a practice changing versus a practice enhancing kind of a moment? And so this committee meets very frequently and would vote to prioritize based on that. So it's a very protocol driven. We have compliances, we have rules in place. We have a review process in place that is very frequently done. The research funding is much more of an organizational strategy. And so when we look at the last several years of investments that are made, they're made in areas where science is continuing to grow and some of the most biggest discoveries are, or some of the deepest unanswered questions that still continue to dog us in terms of population areas. So, for example, congenital heart disease is right now having a moment with the association taking a very deep interest in looking at what are some of the unanswered questions and why do we continue to see, lack of improvement despite guidelines being in place, despite some of these therapeutic options being in place. Where are the challenges? And so the board of directors, along with the volunteers, would kind of think through that. And that's how the association makes its decision. It also looks at who needs the funding. So, for example, right now, with basic science taking a little bit of a hit with some of the shift in the federal funding, the association takes a stronger stand in terms of, can we support with bridge funding? Are there early career and postdoc and pre-doc support that we can do? And so there is an entire team that is dedicated to reviewing what is happening in the country and where these opportunities are. They inform our volunteer leaders, our board, and then the board helps makes those decisions and bring back into the research funding. Sometimes, Heather, it's also opportunistic. We might have a big donor who is interested in exploring, we review the opportunity very carefully, making sure that it truly is an investment opportunity and a research opportunity, and then create, and we have good firewalls in place and compliance in place and so on. So we would leverage based on that. And the Buer Foundation is one where we did a lot with stroke and brain health and continue. That's an ongoing research investment that we have.
So when you think about research and translation then out to the general public, where do you still think there are gaps? What do you see? And how do you try to close those gaps? Not necessarily you, but just as an organization and or I think as a larger healthcare landscape, right? How do we help continue to close that gap between the research and the implementation side of it to, from
bench to bedside.
Yes, thank you. That's exactly, yes. Yeah.
So, that's an excellent question. And that's actually one that we invest very deeply in. Our media, science media and communications team works very, very closely with our science team. But the marketing, Katrina McGee, who was also a Komen leader, is the EVP and Chief Marketing Officer at the association. And our marketing team is built across a continuum. So we have a science media and science communications team. We have, another team that's on the digital side. There's an entire team on brand, an entire team on, working with like influencers and so on. So very deep ingrainment on the need. We're very clear that there is a need to make sure that this information gets translated. And then the how, maintaining the accuracy, the level of literacy, where the media, so clinical trials, for example, our scientific sessions or our meetings where trials are presented, they get a lot of media attention. And so that's something that the association has invested very, very well in and does really well. The continued challenge is today, we are in this era of AI and how large language models, ChatGPT and Copilot can get information to a consumer very quickly. What we are not entirely sure of is how accurate is that information. Is it from a trusted source versus a source? And we're finding so much discrepancy in what's in that consumer landscape. So that's one big challenge. The other one is, meeting the consumer where they are. And right now they're on social media. And so instead of, going to a trusted source or a website, which might be more difficult to navigate, they go to social media, Instagram, where even an MD is a social influencer, but we're not sure if that MD is appropriately voicing what the science is versus a biased, personal like or dislike. And so mitigating some of those challenges are what we are focusing on right now and coming up with. We have very good relationship with the publisher, for example, where our 14 journals are. Is there an opportunity to work there? Is there an opportunity to work with some of these, larger companies that work in the AI space? Are there ways in which we would develop our own chatbot? And Katrina's right there at the very helm of it, looking at, how do you bring some of this great science in ways so that the association is where the consumer is going to first as their trusted source. More recently, I know a brag point in the association was that people said that the American Heart Association was trusted right after a person trusts their doctor. So we're second in line right there, which, is wonderful to know that that's the information. But that also comes from the decade worth that the staff have invested in, training, reviewing. My team does content generation and the accuracy, reviewing for accuracy of what the communications team does and sends out. It's a very strong relationship with that team and working in that way.
So let's talk a little bit about AI, right? Because it obviously is a hot topic across the world, but especially in healthcare. And so you are so grounded in the science, right? And then there's kind of AI over here. And so when you think about the future, how do you see AI being incorporated to the science and the healthcare?
I see AI. I mean, we're right now So one, the association and our leadership invests very heavily in understanding AI and making sure that executive leaders across all are appropriately trained, understand the opportunity, and really look for opportunities where AI can help them. And then the question is, where would it help you? And so, things like improving your workflow, improving the opportunity for these deep searches and faster recovery. We're looking at it, for example, on a pilot project in our guidelines, where we are using our top, the way in which we get our evidence, which is the manual searches and the literature review strategy, and then testing it with AI to see what the discrepancies might be. Who does it faster? Obviously AI, but how and what does AI miss, so that we can refine the query and we can refine the process of using this great tool.
Yeah.
So I think fundamentally what it would come down to, Heather, is AI is not going to replace somebody, but AI could replace the bodies that don't use AI, and being trained in effective use of AI, knowing when to query, how to query, use of right prompt, the ability that AI has to either, polish the work you're doing, it should never replace the primary thinking. It is absolutely a great tool to augment your process, your thinking. I use AI as my brainstorming kind of friend sometimes, because my staff team might be busy and not want to brainstorm with me. But I'm also cognizant about using queries of accuracy and, the strength of the recommendation or the dependability of that information, because it can make up based on what it accesses. And if the information it accesses from is inaccurate, you're going to get an inaccurate response as well.
Yeah.
So when you think about the next 5 to 10 years, where do you see prevention versus treatment in heart health, but then overall too, right? Because heart health, like many things, is connected to all different pieces of the healthcare. And I still think, just from my being in the world I'm in, prevention is, we talk about how important it is, but then we don't follow up with the investment it actually takes to do prevention properly. So I'm curious how you see it over the next 5 to 10 years. What does that look like to you?
I think fundamentally what we are seeing is prevention is, or healthcare itself is changing from a episodic, looking at one piece, like an organ only, like just your heart health or just your vision or just, to a much more integrated whole health, whole person focus. That's the first part. Second, predictive analytics, risk assessment. That's going to be a big game changer, as well as we continue to refine those tools, risk stratification to understand who gets what treatment and when, versus one-stop shop for everybody. Personalization is going to be a big game changer as well. I think just because of how innovations and discovery have really helped the field of personalization, patients and consumers are going to know more. Caregivers are going to have more information at their fingertips for that personalized care. I think precision medicine, anything precision nutrition is a thing, precision medicine. The association has a precision medicine platform that, we host a lot of the data, and understanding, harnessing that data is one big piece of work, but the ability to leverage that data, kind of build your predictive analytics, to build your predictive tools, to build your therapeutic targets, that's going to be that next game changer. And so I think that's where you're going to see some of the biggest shifts. I think what fundamentally would still remain would be those gaps in equitable care. And if we do not make sure that those gaps are addressed early, the holes that we have seen and those gaps we've seen will continue to kind of build and exacerbate. And so just making sure that you bridge the gap between both all of this innovation and change that is happening, but the existing issues that have continued to be challenges and obstacles, people who are not getting the care that they deserve, those in rural areas, those in underserved areas. I mean, if we don't pay attention and close those gaps before these rapid changes happen, you're still going to miss those that need the care more. So I think that's where care is going, overall.
Yeah.
especially with heart health, though.
Yeah. So talk a little bit about heart health and vision.
Such a strong relationship.
Yeah.
So, as you know very well, there is a very strong relationship with the predominant risk factors that we call the cardiovascular risk factors and then ocular risk factors as well. So, when you think about it, smoking, we have enough published studies that show the link between those who smoke likely have poorer vision than those who do not. Those who have type 2 diabetes likely have poorer vision and vision loss than those who do not. Those who have obesity and overweight likely would have less physical activity and engage less in physical activity, which is then also tied to the health of your eyes. So, when you think about each of these factors, that crossroad is very, very strong. And the association has what we call the life's essential eight. There are health factors and health behaviors like your glycated hemoglobin, your blood pressure. Blood pressure and vision is such a very strong stroke. I mean, one of the first kind of symptoms of stroke that you would start seeing is vision loss, and so on. So there's just so much of that crossover that I think it is safe to say that if you are at risk for cardiovascular health in any of these areas, you are likely at risk for poor vision health and vision loss as well. And I also know that some of the things that we are seeing with like AI and predictive analytics and the ability to understand ocular health, retinal health or imaging, they're the same techniques that are also being used to understand, reading through images and understanding what that means in terms of sleep apnea, what that means in terms of obstructive sleep apnea, and stroke, for example. So very strong crossroads between the both, and certainly a place for us to kind of pay attention to, because like I said, it's no longer just the heart, just the eyes. It's the whole person that care is going to be focused on.
It is. She's a great OD in Dallas, Fort Worth, Dr. Jennifer Deakins. And a couple of months ago, she was on the podcast and she talked about how, eye doctors have the advantage of seeing your vascular health like up close in person without having to. They're the only doctor actually probably that they don't have to cut into you to see your vascular health, right? And I thought that was a really great way to frame it, because I don't think most people think about, right, heart health, eye health, even chronic disease and eye health. I still think we are very much separated into, we do still think about this organ, that organ, right? And I think the way we present information is still very isolated to one area, right? And it's been fascinating as I've been in this role to really watch the light bulb go off when we have these conversations, right? I'm with just the general public of one of the reasons we talk about getting a regular eye exam is it's not just about whether you wear glasses or not, right? An eye exam tells so much about what's going on in your body. And one of those things is directly related to heart health, right? And so
Absolutely.
I think it's a great opportunity to continue to really emphasize how important all the pieces work together.
Absolutely, Heather. I mean, more recently we had a close relationship with Delta Dental and talked about oral health and cardiovascular disease. And for a while, the only things that an average consumer would know is, well, you need to brush your teeth every day, and that's just good, dental practice. But it wasn't really just about cavities. It was about, periodontitis and what impact it could have on cardiovascular health, and where there's been now more published evidence on it. Eye health is even more so, even more so front, because like I said, with stroke, anything that happens in the brain, one of the first areas that gets impacted is going to be vision. And people don't realize that it's not just when you have a stroke that your vision could get impacted. It is all along as you're aging, even with healthy aging and cognitive decline and dementia, your eye health is going to get impacted. And understanding that early on and taking care of your whole being is going to be really important. The role of medications and medications that could contraindicate, that could also impact your eye health. And so eye health is just such a foundational and fundamental aspect of health that we take for granted,
Yes.
and I don't think people understand how much it is tied to your cardiovascular health as well.
Yeah. So how do we change that?
I think the opportunity, one way that the association has looked for some of these kind of causal associations and or linkages is a science manuscript typically starts that. That's one way of doing it. Some other, ways that we do that is our regions are really good at tapping and looking for those collaborations and ironing out what would be a campaign and or an educational promotion that could be spoken about. If there are trials that, or, we have early career or even our mid-career researchers who would, speak at scientific sessions, we would kind of take those pieces and blow those out and, produce more for the consumer. So there are multiple ways in which we can explore that. And it's a question of, how would we partner and how should we partner and who needs to be at the table to do that effectively.
Yeah. Yeah. Sounds like we need to add that to our to-do list after this.
Absolutely.
After this.
Yeah.
But you talk about collaboration, and I think that is a key part to our job, regardless of what organ we're focused on, right? But just in the sector. So when you think about who's been successful at collaborating, who comes to mind? What does that look like?
Honestly, I would say the Heart Association has been a great example. When I joined the association and was kind of looking from the outside inside, now I'm an insider, but the early years I was still kind of looking, from the outside, and I would be amazed at how the association brought multiple groups to the table as a convener. And so the many personas the association has taken is a convener, a catalyst, a primary leader, a voice, a stakeholder, but a champion. But I think the role of the convener is certainly one that the association has played really, really well. There are, others that, for example, I know that the Bush Institute was instrumental in pulling together multiple stakeholders with the WHO and CDC. And, it's interesting how when presidents leave their presidency, everything to do with politics is left behind. And you get to see the person for who the person is and what really motivates them and, gets them to become the champion. And it was really amazing to watch President Bush and Mrs. Bush champion for cervical cancer and breast cancer, in Africa. I mean, PEPFAR was a program that he was very invested in, and there was nothing political about it. It brought the best minds, good thinkers, stakeholders, multiple countries together to really just solve for the problem. And I think those are all the reasons why you can see, if you see that being done elsewhere. It was a public-private partnership, so also one of my first exposures to one, and a format that I thought was incredible. But yeah, I would say those are two examples I can easily share.
Great examples. So what do you think is one misconception about heart disease that still needs to change?
I think most people think of heart disease as a man's disease. It impacts men more. I don't think people realize that outside, it is the number one disease that is tagged as the killer of women. And so for women who die, it is heart disease is the number one reason of mortality statistics. And a lot of times, people talk about misdiagnosis or misdiagnosis. It really is about the opportunity. So when you think about a woman's life across the continuum, most women don't actively advocate for themselves. They don't have the time to do so. They're so busy with, either career or primary caregiver or all the multiple roles in which they might be, even if they're not a parent, right? I mean, you're still a daughter, you're still, career person and so on. So you don't think about until something goes wrong. So the opportunity to understand and, know your own numbers, know what should be, triggering a question between you and your doctor When should you be talking to a doctor? I mean, we have an excellent group of lay stakeholders, all of who are patients. All our clinical practice guidelines, in with those experts that we pull in, will have at least two patients. So our guidelines on heart failure will have two patients who are survivors of heart failure or live with heart failure. And the reason why we include them is because we try never to forget that ultimately the work that is being done is to change their lives, is to improve symptoms for them, is to improve treatment opportunities for them. And so it's really important to understand, when these decisions are being made, can they see themselves, as a recipient of it? I mean, is there hardship for them to access that drug or the system and so on? So there is all of that, I think, that one kind of forgets. And that's a big reason why I think what we do matters.
So the stats say what? That more men have heart disease, but more women actually die from it. Is that correct?
Yes.
Yeah. So one of the things, so I agree with you. We actually, I think it was 2 years ago, brought together a group of panelists to talk about caregiving because most of the time the burden does fall to women. We also had the conversation around advocating. Women are not really taught to advocate, to ask questions, to feel comfortable. And it is something you learn how to do, right? It is not something normally that you just, okay, I have all the skills I need, right? It is something that you learn along the way. And I do think it is something as healthcare organizations really helping, and I would say everyone that doesn't feel comfortable having those questions, having those conversations, asking those questions, male or female, right? But typically the experience has been that women definitely do not ask those questions. And so, in the vision world, women have a higher risk of vision loss. And so we really kind of set on this path at least 5 years ago to really help women have the conversations they needed to have to talk about that. What stops you from asking questions? What stops you from demanding a change in care if it's not working for you? All those things that I think lead to better outcomes, right? And so it's been really empowering to have these conversations and support women in that way. But I do think you're right. It's interesting you say that because I think overall, most people think it is a disease for men. So
women die from it more. And the other part of it, Heather, is I think women worry about being dismissed for talking about symptoms, right? I mean, so I think the opportunity we have at the association is really looking at it twofold. One is educating the consumer and the patient. But the other side of it is also educating the clinician. When your patient comes to you and talks about these symptoms, how do you couch the response so that your patient doesn't feel dismissed? You can take them seriously. And maybe their symptoms are not serious or life-threatening, but don't, share your feedback in such a way that would make them think next time, if it is something that is life-threatening, they're not going to talk about it because they felt, it was not something to bring up. So I think that's the part of it. And you're absolutely right on demanding better care. We don't. We are trained to kind of adjust and, just go with the flow. And it's not a bad thing to demand better care for yourself. I think starting with teaching your children, all the way across the age groups that you deserve to live the best life you can. You deserve it. It's not something that, is something you have to chase. You deserve it. And I think just starting from there helps everybody then do a better job.
Yeah. Well, and I think ultimately too, right, finding who you're a fit with, right? Because it really does become about relationship and trust, right? And so not being afraid if the first provider you see doesn't work or there's not a fit there, keep looking for one until you find that fit. Because I think ultimately that is part of the process too, is finding the right person you're going to listen to, right? That you trust and you believe in, and that will help you adhere to treatment. And I think we don't stress that enough either of, it's okay to keep looking. If the first provider doesn't work or, you don't feel comfortable, then keep looking until you find that person that you do feel comfortable with. And I think that we don't do that enough either.
I agree.
No.
I agree.
So now let's talk about where you are in your journey of your career. What does success look like for you now and 5 years from now?
I think having established credibility with the association and, people that I work with, the volunteers, our leaders, our staff, I think that is a good indicator of you've been working in the ways that we want you to work.
Yeah.
What does success look like for me? Volume is always going to be an issue and so on, but I think the ability to still dialogue and have ideas that, I bring up, executed or implemented or invested in is a big one for me. I can ask for resources, and even in a very constrained environment, the fact that I do get a patient ear and I do get, opportunities to say, okay, we might only have this. What else can you do? And how else can you do it? Versus, hey, no, you can't. I think that credibility helped. But the success now for me is, but because of that, I do get that here. I do get, senior leadership saying, all right, let's listen and not be dismissed. So that's a good place to be with what I want to accomplish. So the other part of it is a strong membership. I love that mentees of my current leaders are the ones who are coming and wanting to stay engaged. And so when somebody asks me, is there a role for me? I always tell them, be careful what you wish for, because the association will just suck you up. And, it's very true. And so I think that's the part of it that I find probably the most exciting. And I don't think I'm ever going to tire from that.
Well, I love watching you. I definitely think this is your calling. Watching you thrive at American Heart, and you certainly did at Komen too. But truly, it has been a great privilege to watch you find success and just root you on. So, thank you for all the great work you're doing.
Thank you. I appreciate that so much.
Yeah. Well, and I think it's important that part of being especially a woman in a high level role, and it for me it comes back to that support network, right? And relationships like this, I think, are what for me feed my soul and remind me of what's possible. And so I just think it is extraordinary to be in this place, to work with people like you and the people that we have worked with across the healthcare sector for the last 2 decades. So thank you. Thank you for sharing your story. Thank you for your work and your leadership. And thank you for your friendship.
Back at you.
Well, we always talk about how our listeners can support PBT, get involved with us. We are always looking for volunteers, donors, committee members, screeners. So we would love to have you join the Prevent Blindness Texas family. And if you want to reach out, feel free to email me, email any of the staff. We're always willing to sit down and have a conversation. And thank you for being loyal listeners. And, we always end our podcast with, tell us what your vision is. Thanks and have a great day.
Thank you.